I'm Tonya Hauser. I'm the nursing director here at Health Ministries, and I've been here almost 3 years. I started right before COVID hit. Normally every year I do a mammogram, and during COVID, everything was on halt, so we didn't do a mammogram. And then the following year is when I found a lump in my breast, and it was painful, and we started kind of looking into that a little bit more. And then after biopsies, found out that I did have breast cancer. And so at that point, we further went into surgery, and then I've had a double mastectomy because we had cancer in the other breast as well. So I did have a double mastectomy. After that, I did not have to do chemo or radiation. At that point, I did a hormone blocker, which just stops the hormones. So since my cancer was hormone fed. At this point, I'm thankful that I had a provider who did go further and recommended that we did the mammo at that point when I was having problems, and we found it from there. Thinking back, if I would have had my annual mammo at that time, maybe we would have caught it sooner, but at least we did catch it before it was metastasized. But my recommendation for everyone, especially over 40 or family history, is to do your annual mammograms. I did skip the 1 year, and then that's when we found it the following year. I did not have breast cancer in my family, didn't have any history. So I was a little bit surprised when I did find out that it was positive for cancer. So I didn't get too concerned when we had when I had the lump. I thought it was more hormonal, but thankfully, again, I had a provider who encouraged me to continue on and follow through with that. And at this point, everything is great, but recommendation, follow up if you have any concerns, any questions. Do your monthly self-breast examinations, and if you find anything abnormal, to get a hold of your provider as soon as you can.